So most of the people are Christian, others Muslims, but there's a
Yes.
group who have traditional spiritual beliefs.
Yes, of course, yes.
And in this group, they do not believe that the germ theory and disease is caused by microorganisms, but they believe like maybe someone cursed you, someone was witchcraft, or there was an evil eye. And even some of them do not, I will say, believe in modern medicine. Like,
yes, of course, yes, they are critical. Yes.
Yeah, and so I was thinking, from what I've seen in the wards, the doctors usually neglect the spiritual aspect of these patients, and maybe I would say can perform some interventions. This and not really holding on to the autonomy of the patient, since if you follow what they will say, they will die. So I was wondering that aspect of it, how best to bring it out in the study.
Yes, traditional beliefs and traditional medicine too, because those beliefs have also a therapeutic aspect. For instance, traditional healers who address those beliefs. I would say the word hospitality, hospital, comes from hospitality. So hospitality wants to say welcoming the patients. Very important. So in my opinion, also welcoming the people's beliefs. Not, let's say, devalorize traditional beliefs, because there is also wisdom in those beliefs. And I think, between quotation marks, a Western doctor or Western medicine trained doctor should have this humility to honor and to let's say to appreciate traditional beliefs. I think also in our European culture we have traditional beliefs, and we have superstitions and criticisms and whatsoever. So having this spirit of hospitality, welcoming the patient with his or her beliefs, and yes, making the best of our proposals when we have in our Western medicine a surgery or chemotherapy, so we should suggest it, and or a vaccine, of course. So this is the question of medical and health education, which should, in my opinion, always integrate traditional medicine. For me, it's important. So it's more credible a doctor who is humble, I think, who accepts, for instance, the wisdom of family medicine and so on. I think it's not a contradiction. We can, in Europe, we make an effort to integrate complementary methods and home remedies to medicine. And so in more traditional cultures, it's somehow easier to accept it. I don't know whether this answers to your question.
Yeah, I think you've answered it.